another common question, what are cardiac devices? And a very important question, I think all of us should know briefly about cardiac devices. Cardiac devices are electronic devices which are implanted in the chest area, either here or here, commonly here, but they have leads through which they function and they are implanted inside the heart through veins. Now, typically there are three kinds of cardiac devices. Number one is pacemakers. Number two, ICDs or implantable defibrillators. And number three, CRT or cardiac resynchronization therapy. Now, talking about pacemakers, they are the simplest form of devices, although they have their own sort of developments and advancements. But pacemakers are implanted in patients with symptomatic bradycardia or slow heart rates. ఎవరికైతే హార్ట్ రేట్ చాలా పడిపోయి స్లో అయ్యి వాళ్ళకి సిమ్టమ్స్ వస్తుందో అలాంటి పేషెంట్స్కి మనం పేస్ మేకర్ ఇంప్లాంట్ చేస్తాం. సో పేస్ మేకర్ ఈజ్ ఇంప్లాంటెడ్ ఇన్ పేషెంట్స్ విత్ వెరీ స్లో హార్ట్ రేట్స్ హూ హ్యావ్ సిమ్టమ్స్ లైక్ giddiness, loss of consciousness, breathlessness or tiredness. Depending again on which chamber of the heart is slow, I mentioned about the chambers of the heart, we have different devices or different kinds of pacemakers. Talking about implantable defibrillators, these are more complex devices which are implanted in patients who have survived a cardiac arrest or ఎవరికైతే ఆల్రెడీ కార్డియాక్ అరెస్ట్ జరిగిపోయింది అలాంటి ఈవెంట్స్ నుంచి సర్వైవ్ అయ్యారు సిపిఆర్ అయ్యి ఆర్ are at a risk of cardiac arrest. Who is at a risk of cardiac arrest? People who have had previous heart attacks, people who have LV dysfunction or heart failure and have already had an event or are going to have an event, which is just depending on their risk profile. మీరు చూసే ఉంటారు, టీవీస్లో చూస్తారు, మూవీస్లో చూపిస్తారు, డిఫిబ్రిలేట్ చేస్తాము, పేషెంట్ని రివైవ్ చేపిస్తాము త్రూ సిపిఆర్ ఆర్ దే ఆర్ గివెన్ షాక్స్. సో defibrillators are implantable automatic devices which are implanted and they can revive patients anytime they go into a cardiac arrest like spell. So they are life-saving devices. Number three, what are cardiac resynchronization therapy or CRT devices? They are the most complex in terms of the hierarchy of devices. They are implanted in patients who have severe pump dysfunction or heart failure. Again, not all patients who have heart failure are suitable for CRT. Only some of them are suitable. But in the right patient, given the choice is right and the execution is right, they can improve the heart function. So అలాంటి పేషెంట్స్లో ఇంప్లాంట్ చేస్తే వాళ్ళ ఎక్కువ సర్వైవ్ అవుతారు, వాళ్ళ క్వాలిటీ ఆఫ్ లైఫ్ చాలా ఇంప్రూవ్ అయిపోతుంది and they really feel much better after a CRT in terms of heart failure outcomes. So by and large, these are the three devices that we implant. Thank you.